It's really nice to see so many people out tonight interested in improving their health and learning about their health. It's really, really quite refreshing. My name is Dr. Jillian Lankford. I'm one of the psychiatrists at the Outpatient Behavioral Health Services Clinic. And I'm a psychiatrist by training, but I have a special interest in women's health care. And I see generally adults, a few older adolescents, but really enjoy seeing women and taking care of women. So tonight what I want to do is spend a little bit of time talking about mental health care and how we can improve our emotional strength and resiliency, and how our mental health is very closely connected to our physical health. So like I said, our physical health, how healthy our bodies are, affects how healthy our mind is going to be, and vice versa. If our minds aren't healthy, our bodies aren't going to be healthy either. And they really are very, very closely connected to one another. So keeping a healthy body helps your mind be healthy, and just the other way around. So taking a look at the link between mental health and physical health. People who have a lot of chronic illness, chronic things like diabetes, hypertension, coronary artery disease, many of the things that we've already talked about tonight, heart failure, we find that those individuals tend to have higher rates of depression and higher rates of mental illness in general. And for example, in other medical illnesses like end-stage renal disease, COPD, cerebrovascular disease, many of the studies out there have shown that depression rates actually triple. And unfortunately, what we find is that there are increased rates of death with individuals who have both chronic illness and depression. And that's not only related to death from their physical illness and from their general health problems, but also from suicide. Suicide is one of the big risk factors for completed suicide is having a chronic medical illness. So it's really important to try to keep your physical health in the best shape possible in order to keep your brain healthy too. And it goes the other way around too. Anybody who's experiencing chronic mental illness like depression, schizophrenia, bipolar disorder, they can have physical health problems too. If you're experiencing depression, how you perceive your health and how you perceive your body can definitely be affected. If you have a lot of negative thoughts and are feeling sad and down a lot of times, you may think that your health is in worse shape than it potentially is. What we find is a lot of times in individuals who are experiencing depression, they tend to have a lot of somatic complaints, trouble sleeping, fatigue, trouble with their memory or their concentration. And they complain a lot about physical problems with their body. And pain is also a big issue. I'm sure many of the other doctors that are here tonight have a lot of patients who are experiencing chronic pain. And what we find a lot of times is in depression, people tend to have more pain and experience pain in a little different way than other people. So it's really important to try to keep your mind healthy too, and that's one of the other topics here of our talk tonight. So because your physical health and your mental health are so closely linked to one another, it's important to try to maintain both so that you can keep both healthy. And tonight I want to talk a little bit about how to maintain an overall mental well-being, and some of that involves keeping your body healthy as well. So I want to touch on a couple of topics tonight, and those include nutrition, exercise, sleep, and stress. And all of those, we all know what a little bit I'm sure about each of those topics, but I want to talk about those in a little more detail and maintain an overall healthy mental well-being. So let's talk about nutrition first. Obesity is epidemic in our country and in other countries, and it's one of the leading causes of morbidity and mortality worldwide. It can lead to more physical health problems, diabetes, high blood pressure, high cholesterol, and chronic physical illnesses that can also affect how our brain is functioning. So getting obesity under control is really important, as many of the other physicians tonight have talked about. And one of the important ways to control obesity is making appropriate food choices. You see the nutrition pyramid here, and filling your body with lots of whole grains, fresh vegetables, water can help to reduce your risk of illness. Not only reduce your risk of illness, but it can help to improve your energy and improve your memory overall, which affects your overall mental well-being. So how do you do that? I know it's something that it's much easier said than done. And how do you make changes to your nutrition? How do you improve it? Well, one of the ways to do it is by starting very slow, making very slow changes to your diet, introducing one fresh veggie a week, or substituting olive oil for butter, making just slow changes in your diet. Certainly, we all know what crash dieting does for us. Usually, we quit or give up, or just we end up bailing and eating that piece of chocolate cake instead. So starting slow is really the key to improving your nutrition overall. Everything should also be taken in moderation. It's okay to have that extra one piece of cake or a small slice of pie or a piece of chocolate here and there. You shouldn't give up the things that are really important to you or the things that you really do enjoy, because everything is okay with moderation. Certainly limiting your portions. I'm sure you hear on the news, controlling your portions is also key to improving your nutrition. Portion sizes in restaurants are huge these days. Asking your waiter to bring out half of your meal for you so you can take the rest of it home, splitting a meal with a friend when you go out to dinner, or using smaller plates just at home when you're cooking dinner for yourself so that you don't fill up your entire plate with all the pasta you could eat, for example. And obviously, like we said before, enjoying fresh fruits and vegetables, using a lot of color in your diet, adding lots of greens, reds, yellows in your diet to add some variety to your diet will be helpful. And limiting your sugar and your salt intake is always important. Trying to reduce the number of processed foods that you buy in packages, usually located in the middle of the grocery store, are often troublesome for your diet and for your overall well-being and nutrition. Second topic I want to talk about tonight is exercise. Exercise is extremely important in improving your overall physical health and your mental health as well. Exercise improves blood flow to the brain. It stimulates the growth of new nerve cells and can help with overall improved learning and memory. It can also help with improvements in your mood. It can help to control weight and keep your weight down or at a steady state so that you don't develop obesity and then develop worsened just general physical health. Exercise also helps to change endorphins and monoamine levels. We've all heard about endorphins, and those are the kind of feel-good, opiate-like proteins that are produced by our brain when we exercise and can help to reduce both pain and help us feel good. Exercise also reduces cortisol level, that nasty stress hormone that everybody always hears about and talks about. And exercise really does come in all shapes and sizes. It's not, nobody has to go out and be the marathon runner like the woman in the picture here. It can be anything, running around with your kids outside on the playground, chasing your dog who gets loose down the street. There are a lot of different ways you can exercise. Spending time with friends and family outside, walking from a parking spot far away from the grocery store, or just walking in general, taking the stairs at work. Those are just general ways to get a little bit of extra exercise and improve your overall physical and mental well-being. Sleep is another thing that's really important. I would say a good majority of my patients complain of sleep problems. And sleep is really important. Getting adequate night's sleep and restful sleep is really important in improving your overall emotional resiliency and mental well-being. Sleep tends to improve your productivity, your emotional balance. It can improve energy and restore both your body and your mind. So how do you get better sleep? Keeping a regular sleep schedule, trying to go to bed at the same time every single night and waking up at the same time every single morning can be difficult, especially when you get a night off and you want to spend time with friends or sleep in on a Saturday or Sunday morning. But we all know what that feels like to try to go back to bed again after you've slept in a few nights over the weekend and try to go back to work on Monday morning. It can be hard to fall asleep on Sunday night again and hard to get up on Monday morning again. So keeping your schedule as regular as possible is one of the keys to getting better sleep because it trains your body to wake up and go to bed at the same time. Exercise, I know we're kind of harping on a little bit on exercise tonight, but exercise is really important in getting better sleep. It helps your body burn off some energy, burn off some steam so that you feel tired when it's time to go to bed. Eating regular meals, especially trying to avoid meals right before bed or going to bed too hungry, can interrupt your sleep schedule and prevent you from getting good sleep. So trying to eat regular scheduled meals is always helpful for sleep. Also developing a bedtime ritual as far as finding things that you do every single night that get you ready for sleep, whether that's reading a book, washing your face, brushing your teeth, kind of having a ritual that you go through every night, putting your kids to bed is helpful for getting your body ready for sleep. And I'm sure we all know what distractions are presented to us at bedtime. There are a lot of distractions, and reducing the number of distractions both in your room and around you when you're trying to go to sleep can be very helpful. Keeping the room dark at bedtime, trying to minimize number of people in your bed at night, and I'm sure there are plenty of you out there that have kids that want to crawl into bed with you, or dogs, or pets, or cats that move around a lot during your sleep. That can prevent people from getting good sleep too. And so trying to keep the number of distractions to a minimum is really important. There are a lot of other relaxation techniques out there that people can use to help get better sleep and to help relax you before you go to bed. Some of those include diaphragmatic breathing. Using like very deep breathing before you fall asleep can help to relax both your body and your mind. Meditation is sometimes used as well to help relax you so you can fall asleep easier. And lastly, I want to talk about stress. We all know what stress feels like. We are women who have a lot of responsibilities. We're wives, we're mothers, we're employees, grandmothers, aunts, and life is stressful. I feel like we're always trying to balance work and friends and family, and it's hard to keep all of those in order, let alone keep yourself in order. So and it's important to, one, recognize that stress is a very natural part of our lives, and we all deal with stress. But how we deal with it affects how well and how well our mind works and how healthy we end up being in the end. It's really important to take one thing at a time. I know we all like to probably think of ourselves as really good multitaskers, and in general we tend to be, but it can make us more stressed out to try to do several things all at once, and can make us more forgetful and lead to more memory and concentration problems. So taking one urgent issue at a time and trying to tackle it and finish it and moving on to the next thing can help us reduce stress. Also, setting manageable goals for yourself. I'm sure many people like to go out and say, I'm going to do this and this and this and this and this all day today and try to finish it. And it's somewhat disappointing when you don't get it all done, which can lead to more stress. So setting manageable goals to yourself, things that you know for sure you're going to be able to easily complete and reach, can help to reduce stress as well. Learning to say no is a big way to reduce stress. I'm sure that we all get lots of requests from family and friends and work to do the next thing and to be the better person. But learning to say no and learning what your limits are is also another way to help reduce stress and improve your mental well-being. Again, exercise comes right back into the picture. maintaining about 30 minutes every day of exercise, whether it's by walking or jogging, going to the gym, taking a yoga class. Just getting some exercise can help to reduce stress. Also, making time for yourself, spending time with friends, family, finding hobbies that you enjoy, something that you just on your own really enjoy doing is really important in reducing stress. And then trying to divide responsibilities at home, and that I'm sure is easier said than done as well for people with spouses and kids at home. Having them take control of some of the things like taking the garbage out or preparing dinner one night can help to reduce your stress too and help you to relax. So now that we've talked about some of the ways that we can improve our overall physical and mental well-being, it's important to also talk about when to move on to the next level and when it's important to look for help and ask for help from a professional. And that can either be from a psychologist or a psychiatrist. If you're finding that you're trying a lot of these techniques to improve your mental health and reduce stress and improve sleep and things just aren't working, it might be time to ask a professional and to talk to somebody about it. If you're having trouble sleeping and really can't fall asleep and find that it's affecting you in your overall daily life and ability to function, give us a call and we can help out with that. If you're feeling down or hopeless, helpless, feeling depressed or sad, crying a lot, and not really sure where that's coming from, that's also another clue that it might be time to talk to somebody. One of the common ways people use to cope with stress and sadness and mental illness is by using food, drugs, or alcohol to cover up their emotions or to cope with their situation. And if you find that that's the case for you, that's usually a time to talk to someone as well. And then again, if you're having or family member or anyone around you is thinking about death or suicide, it's important to talk to somebody probably in an emergency department or directly to your physician or to your psychiatrist that's here. So, and we can talk more about these issues. We have some stress handouts that we can go through at our breakout session tonight.